regardless of what subspecialty you go into, you will give bad news to a patient, right? Whether it is the fracture didn't heal and it means you need another surgery, or your total joint has become infected, or your ACL reconstruction didn't work, right? And so I think with any sort of news, obviously having a relationship with the patient always helps to start off, right? But the truth is sometimes I may meet a patient for the first time and tell them that they have cancer, because every other person they've seen prior to that may not have said anything. And just by reviewing the scans, it's obvious this patient has a sarcoma, right? And so I think, again, relationships help, but I think understanding where the patient is, what the patient understands about their condition, is always helpful, so you know where to start from, right? Somebody walks into my room, my clinic, and I just make the assumption that they know that this is a cancer, and I start talking about sarcoma, and then they look like a deer in headlights thinking, wait, doc, what are you even talking about? Are you saying I have cancer? And you kind of have to walk back and say, okay, this is where I am. So again, I think understanding where the patient is, what they know about their condition, is really important before you start sharing bad news.
What kind of questions do you ask to determine their level of understanding of what they have and their diagnosis in front of them?
Sure. You know, obviously in my clinic, I have residents and fellows, so usually they would have gone in to get the history or do an exam. But when I go in the room, of course, I introduce myself and say, Mrs. Johnson, why are you here? And sometimes they will look at the resident and say, well, I just told you. It's like, well, I'm here. I just want to hear it from you. So I think just an opening question of why are you here? One thing also I think that's important is acknowledging the other people in the room. So I would always ask, sir, you are, or ma'am, who are you? Just one, it acknowledges that you are recognizing the other people in the room, which I know that, of course, the patients appreciate that. But also it gives you context, right? Because maybe, you know, on the pediatric side, sometimes there will be a lot of patients in the room with a child and their parents, and maybe sometimes the parents maybe don't want the sibling to hear the news, or an aunt or something like that. That also helps inform that discussion. So again, knowing your environment, who's in the room, what do they know, I think is always a good place to start. And then I follow up with, why are you here? What did the other doctors tell you about X, Y, and Z? So then I know I'm building off of whatever knowledge they have and go from there. And then nowadays, a lot of the time, probably not the first thing I ask, but when the patients start asking questions, then I say, well, did you Google that, or did you get that from ChatGPT? Because a lot of people come with information that they have. And I think it's also important to know that so that you can address the potential things they may have looked up and to answer those questions that may have come up from their AI searches or whatever.